Hello everyone, welcome to Dr. Kim's Dental Radiology channel. In today's video, I'm going to show you what I call super incisive nerve. Of course, that's not an anatomically correct terminology, but based on our anatomic understanding, incisive nerve courses anteriorly to anastomose with lingual nerve within the lingual canal. That's what I have learned and read about it in the textbook, but have I almost never have seen that occurring in cone-beam CT. Well, before I go further, let's clarify what incisive nerve is. We all know what inferior alveolar nerve or mandibular canal is, right? So from this 3D rendering, we know the mandibular nerve courses anteriorly, such as here, and one of its main branch exits through the buccal cortex, which we call mantle foramen. But the other branch courses anteriorly, such as this, and continues to supply the nerves to the mandibular incisors. But how well can we see this incisive nerve? Based on my experience, having looked at several thousands of these cone-beam CT scans, most often, once we identify this mantle foramen, we can see that it courses anteriorly for perhaps 1 to 2, maybe 3 teeth to the canines and lateral incisor, but almost never I see it actually anastomosing with the incisive nerve. But in this example, we do see that, and I want to share that with you today. So now, I think the axial view best represents that anastomosis. So why don't we do that? Okay, so we're going to be looking at the left side primarily. So let me go up and down, and I want you to follow this radiolucency, which represents the mandibular canal. So it's coursing anteriorly as expected, and there's our mantle foramen, right? So let's go ahead and go back again. So it's coming down and then exits. It does have a very unusual morphology, by the way, canal morphology, which we will look at it even closely. But let's try to pay attention and see what's happening to this incisive nerve. So it's coursing a little bit toward, going back to the center of the alveolar process or the body of the mandible. And right about here, you can see that it's coursing anteriorly, right? It's actually coursing in this direction. It may be a little bit hard, but let's go up and down and up and down. And hopefully you can see that it's now coursing in this direction. Do you see that? And what's happening here is actually, you can see it anastomosing right here. It goes like that and then comes around to anastomose with the lingual canal right there. Do you see that? It's now continuous with the lingual canal. So there's the full course of the incisive nerve. Right here, and then goes like this, and goes like that, and that, and this, right? So I hope you can see that. So I call this super incisive nerve because, again, I don't ever remember, perhaps there have been a case, but it's highly unusual that I can actually trace it all the way as good as this one, but we can in this case. Whereas if we now look to the patient's right side, you'll quickly realize that it's not very obvious where it's coursing, whereas it's a lot clearer on the patient's left side. So I try to look at this in the coronal view, and it wasn't as easy to see that. So So here's our mental foramen right here. You can see the part of the incisive nerve. Let me hide that crosshair. There you go. They're joining right here. But you can see that the canal, why it's so difficult to trace, because unless it has that nice corticated outline, the radiolucency or the incisive nerve sort of blends in with the rest of the trabecular bone. That's why often it's so difficult to see that, but this is highly unusual case where we can actually trace the entire course of the incisive nerve anastomosing with the lingual canal. Should we look at it in the sagittal view as well? So first of all, let's find the lingual canal. There it is. Okay. There's a mental foramen. You can see this incisive nerve has a lot of other branches that extends to multiple different directions, right? So that's the next point that I want to talk about. Now that we've seen this incisive nerve, does it always just go toward the midline and stay within the boundaries of the cortical plates? And absolutely not. Look at this one. So here's a mental foramen. After the mental foramen, right? It's after passing the mental foramen, it bifurcates here into potentially multiple small branches, and then the one courses back posteriorly to the molar area and exits here, right? Exits through the lingual cortex. That's located distal to the mental foramen, and similar feature can be seen on the contralateral side. Here's the mental foramen, and let's try to follow the incisive nerve, right? There's another branch, and what's happening to that? Wow, there's a pretty major branch that's exiting through the lingual cortex, and we should be able to see that in 3D rendering. There you go. So here's the incisive foramen, lingual foramen, and the other accessory neurovascular bundle exiting through the lingual cortex. Isn't that interesting? So I think the lesson to take away from this is not only I was able to share with you this the full course of the incisive nerve, but I want you to note that everyone has a very unique anatomic variations, and these canals can have multiple branches that can exit through either lingual cortex, which is what happened in this example, but perhaps even through the alveolar crest, that it will go all the way to the top of the alveolar crest. And just keep that in mind. There's a lot of anatomic variations that I see in Combim CT that otherwise you would not have been able to pick up on two-dimensional images. So if you like this video, please hit the like button and subscribe to my channel, and I'll see you next time. Thank you for your attention.